Hi, today I will be talking about hepatocellular failure. Now, what is this hepatocellular failure? Whenever there is any compromisation in liver functions of hepatic cells, then it is known as hepatocellular failure. Now, this hepatocellular failure can be caused by viral hepatitis. Any viral hepatitis can cause hepatocellular failure. Fatty liver of pregnancy. During pregnancy, there is fatty liver, and during this fatty liver of pregnancy sometimes the liver functions are impaired and there is hepatocellular failure. Hepatotoxic drugs which are damaging liver, which are hepatotoxic, they can also cause hepatocellular failure. Sometimes when there is severe hypotension because of impaired perfusion of liver, there is severe hepatocellular failure. Sometimes oral contraceptives can cause hepatocellular failure. Sometimes in post-operative period, because of some anesthetic agents, patient may develop hepatocellular failure. If by mistake hepatic artery is ligated during abdominal surgery, patient may develop hepatocellular failure. In cirrhosis, any type of cirrhosis, any condition which is causing cirrhosis, patient develops hepatocellular failure. So overall in hepatocellular failure, whatever is the cause, there is general failure of growth. Number two, there is jaundice. Patient usually have jaundice in chronic hepatocellular failure and even in acute hepatocellular failure. Patient may develop fever and septicemia. Now this fever and septicemia is because of immunocompromisation. As you know that liver is one of the organ which maintains immunity of body. In breath, in chronic hepatocellular failure and in acute hepatocellular failure, there is fetor hepaticus, that is foul odor in breath. One by one, I will discuss about each and every impairment which takes place in hepatocellular failure leading to various symptoms. In hepatocellular failure, patient will develop ascites. There is distension of abdomen with fluid in abdomen. This is known as ascites. In peritoneal cavity, whenever there is fluid, it is known as ascites. So patients may develop ascites. Patient may develop various neurological changes. The higher functions in these patients get impaired. So this is known as hepatic encephalopathy. Patients develop changes over skin. Patient develop endocrinal changes. Patient develop disorders of coagulation. There are changes in circulatory system. There are changes in circulation. There are changes in the functions of lungs. So these are all changes which take place in hepatocellular failure. So first I will talk about general health of patient. General health of patient gets impaired in hepatocellular failure. Now why it gets impaired in hepatocellular failure? As you know, the liver is one of the organ which is responsible for metabolism and which is responsible for manufacturing protein. So whenever it gets impaired, when hepatic cellular functions get impaired, patient becomes weak, easy fatigability is there, patient is lethargic. When you examine the muscle mass, when you examine this muscle mass, there is wide wasting. This is all because of deranged protein metabolism. Patient is anorexic, desire to eat is lost. Now these patients develop jaundice. Now why there is jaundice in hepatocellular failure? As you know about metabolism of hemoglobin. Hemoglobin is totally metabolized in liver, and one of the end product of metabolism of liver is bilirubin. So whenever there is impaired metabolism of this hemoglobin, impaired metabolism of bilirubin, this leads to jaundice. In hepatocellular failure, in various disorders, there is cholestasis, and because of cholestasis, sometimes there is jaundice. So overall, these patients they have jaundice in these patients have jaundice in hepatocellular failure, and this jaundice is because of impairment in metabolism of hemoglobin. Now the patients of hepatocellular failure, they have circulatory and pulmonary changes. There is generalized vasodilatation, and this generalized vasodilatation in cases of hepatocellular failure is because of abnormal metabolism of vasodilating agents, vasodilating chemicals in the body. Now there is one chemical, there is one neurotransmitter known as GABA. One is known as VIP, vasoactive intestinal peptide. One is known as glucagon. Now these neurotransmitters, these chemicals, they are synthesized by enterocytes. And when enterocytes synthesize this, they secrete backwards in the blood. In the blood, these all neurotransmitters, they reach liver, and in the liver they are metabolized. So a required amount of these neurotransmitters reach the circulation. That is required amount, that means the amount which is required by the body for maintaining its metabolism, for maintaining its activity, that much of neurotransmitter it reaches the blood. Now whenever the hepatocellular functions get deranged, whenever there is hepatocellular failure, these neurotransmitters, GABA, vasoactive intestinal peptide, and glucagon, these all accumulate in the blood, and as they are all vasodilating agents, they produce generalized vasodilatation, and these generalized vasodilatation leads to circulatory and changes in pulmonary system. In circulation, as a result of generalized vasodilatation, the whole of the circulation, the extremities become flushed. Why they become flushed? Because of generalized vasodilatation. Pulse become bounding type. Bounding type of pulse is there. Splenic circulation is increased. On the other hand, renal circulation is decreased. The same thing happens in pulmonary circulation. In pulmonary circulation, there is generalized vasodilatation, as a result of which the number of AV shunts, they get open up. Normally AV shunts are present in the pulmonary system. These AV shunts are closed after birth of child. But when these vasodilatation occurs, when these vasoactive peptides, neurotransmitters, when they increase in the blood, when vasodilatation is increased, there is a generalized vasodilatation. As a result of that, AV communications which are present in lungs, they get open up, and because opening of this AV communications, there is shunting of blood from right to left side. That is, deoxygenated blood will enter towards the left side of the heart, and this will lead to mixing of blood. There is mixing of deoxygenated and oxygenated blood, and as a result of this mixing of this blood, patient feels dyspneic. Partial pressure of oxygen goes down below 70, and we call it hepatopulmonary syndrome. So because of this generalized vasodilatation, there is systemic as well as pulmonary changes. In spleen, there is increased vasodilatation, blood flow is increased. So in these patients, you will get splenomegaly. There is hypersplenic syndrome. Spleen gets enlarged. Function of spleen is impaired. Hypersplenic syndrome develops, as a result of which platelet count and overall the count of all the cells in blood is decreased, because spleen destroys whole of the platelets. You can also see changes in nervous system. There are neurological changes in hepatocellular failure. Now, this is known as hepatic encephalopathy. Now, what happens in hepatocellular failure? As you know, liver is one of the organ which is responsible for detoxification of toxins which are absorbed from intestine. Whenever there is whenever the proteins are absorbed from the intestine, they are metabolized in liver. Now, one of the product of this metabolism is ammonia. Normally, this ammonia is detoxified by the liver. As a result of detoxification of this ammonia, urea is generated. Now, whenever there is hepatocellular failure, the level of this urea goes down because ammonia level is increased. It will not get metabolized, it will not detoxify. So this ammonia will act on the receptors in nervous system, in brain, and will lead to encephalopathy. Higher functions gets deranged and we call it hepatic encephalopathy. So there are changes in the nervous system. There are neurological changes. Now there are changes over the skin. When skin of patient of this hepatocellular failure is examined, you can see n number of vascular changes. There are number of vascular spiders. These vascular spiders are dilated angiomas. And these spiders, red color spiders, are usually seen over the posterior aspect, that is on the back, in the region of superior vena cava drainage. It is seen over upper arm, it is seen over the chests. So there are n number of these spider navy. These are known as spider navy, red colored spiders. Now sometimes in a black person who is dark colored, these spiders are not visible. So when we rub piece of ice or ice cube is rubbed over anterior aspect of chest, over the back or over the upper arm, then you can see, you can demonstrate white colored spiders. So these are known as white colored spiders. So these red colored spiders are visible in a fair skinned person, but in a black person, if you want to demonstrate spiders, then you will have to rub a cube of ice over the region where spider navy is seen. Apart from this over skin, many other changes are also seen. When you see the palm of these patients, palm is red colored in hepatocellular failure. Palm becomes beefy red, we say that it is dark red. And this dark red color of palm is because of dilated blood vessels. We call it palmar erythema. So these are the skin changes in the cases of hepatocellular failure. Apart from these skin changes, there are various changes over the sexual organs. In cases of males, when you examine the testicles are atrophied in chronic hepatocellular failure. Apart from this, libido is lost, sexual desire is lost. In case of females, there is atrophy of breasts. In case of males, you can see that there is gynecomastia. So these are the changes which take place in the sexual organs, and these changes are because of changes in the endocrinal system. Now these changes which take place over the skin and the sexual organs is because of vasodilatation. Exact reason of these changes is not known, but probably these changes are because of imbalance between estrogens and androgens in body. Normally, in a normal person, when liver functions are normal, in those cases, the androgens and estrogens, their levels is maintained as per requirement of body. But in cases of hepatocellular failure, this level gets disturbed and relative levels of estrogens is increased. And because of this, in these patients, there is gynecomastia in males, there is testicular atrophy in males, there is loss of libido. In females, you get atrophy of breasts, hair fall, hair loss. These are all the features because of increased level of estrogens. So overall, we can say that in a chronic liver failure patient, if he is male, he goes towards the female side That is, there is feminization of male because of these endocrinal changes. Sex hormone binding globulins. Now, these sex hormone binding globulins, in cases of chronic liver diseases, these sex hormone binding globulins are increased. And when the level of these sex hormone binding globulins is increased, this again leads to the sexual disorders. So overall, we can say that in cases of chronic liver disease, there is derangement in the sexual functions. Alcohol and hepatocellular functions, they are very closely related. In alcoholics, there is derangement in hepatocellular functions, and usually these endocrinal changes are more prominent in alcoholics. In alcoholics, evidence of this spider nevy, evidence of Palmer erythema, Palmer contracture, which is known as Dupuytren's contracture. There is contracture in this region of palm. This becomes like this. So this contracture and enlargement of parotids, these are all more in alcoholics, and this is all because of imbalance between the level of estrogen and androgens. That means in a chronic alcoholics, the derangement of liver function leads to feminization of a person, of a male. If a female is consuming alcohol, if he is alcoholic, then in that case, there is atrophy of breast, there is loss of sexual desire. These are all features in females in a case of hepatocellular failure. So whenever the patients of hepatocellular failure comes to a hepatologist or any physician, he should work on these lines. He should observe all these changes in the patient. So first he should examine the general health failure, whether there is general health failure or not. Number two, he should look after the circulatory changes, whether circulatory changes are present or not, circulation is normal or not, what is the status of blood pressure. Usually the blood pressure is showing white pulse pressure. That means systolic blood pressure becomes high and diastolic blood pressure goes down. It is more than 20 millimeters of mercury. The difference between systolic and diastolic, it is more than 40 millimeters of mercury. We call it wide pulse pressure. So you look for wide pulse pressure. You see for hepatopulmonary syndrome, that means a patient will become dyspneic. You see the partial pressure of oxygen saturation, this goes down below 70 millimeters of mercury. This is because of dilatation of pulmonary blood vessels, increased blood flow in the pulmonary blood vessels from the AV shunts, which are opened up in these cases. So you must see for the pulmonary changes, you must see for the circulatory changes. Another thing which happens in pulmonary syndrome, hepatopulmonary syndrome, is pleural effusion. This pleural effusion is seen in chronic liver diseases. As a result of this pleural effusion, there is compromisation in the pulmonary functions. Sometimes there is basal collapse because of huge ascites in the cases of chronic liver diseases. There is basal collapse of lungs, and there is, as a result of this, there is pulmonary compromisation. Sometimes these patients, they develop pulmonary hypertension. And again, this pulmonary hypertension is because of increased blood flow in the pulmonary arteries, pulmonary vasculature, as a result of which the pulmonary vasculature gets hypertrophied. So you will have to look for these all changes which take place in hepatocellular failure. So pulmonary changes are the one of the very important changes in the hepatocellular failure. Apart from this, there are changes in renal circulation, and these changes in the renal circulation leads to hepatorenal syndrome. Now, this mortality in hepatorenal syndrome is very high, and this is because of shunting of blood away from the kidneys. the perfusion of kidneys is decreased, and because of this decreased perfusion of kidneys in chronic hepatocellular failure, in any type of hepatocellular failure, leads to hepatorenal syndrome. So one should look for hepatorenal syndrome. So whenever the patient comes with hepatocellular failure, clinically you will have to look for all these features. You look for all these changes in a patient. Apart from this, you will have to do pathological investigations. In the pathological investigations, the first thing you must do is CBC, that is whole of the hematological study. In this, the hemoglobin level may go down in a chronic liver disease, in chronic hepatocellular failure. This may be because of blood loss from the GI tract as a result of portal hypertension. All cellular mortalities, leukocytes, platelets, all may go down. This is because of hypersplenic syndrome. Spleen is enlarged because of portal hypertension in chronic hepatocellular failure. So as a result of hypersplenic syndrome, sometimes these patients, they may develop thrombocytopenia and all cell counts may go down. Apart from CBC, the next step is liver function tests. In liver function tests, always evaluate whole of the liver functions like serum bilirubin. Usually the indirect fraction of bilirubin is increased in cases of hepatocellular failure. In the liver function tests, in the second step, you go for enzymes, SGPT and SGOT, gamma GT. Now this SGPT is diagnostic of liver cell damage. If SGPT levels are high, this suggests that there is probability of liver cell damage. There is hepatocellular injury. SGOT is not so specific for liver damage. Gamma GT, again, this is an enzyme which is increased whenever there is prolonged cholestasis. So this gamma GT is one of the diagnostic enzyme for chronic cholestasis. In alcoholics, even gamma GT is increased. Apart from this, in liver function tests, serum albumin is one of the tests which determines the hepatocellular failure. If albumin level goes down, that means there is chronic liver failure. The half-life of albumin is about 25 to 30 days. So usually this albumin level falls down after 25 days of hepatocellular failure, and then gradually it will go down. Normal levels are about 3.5 grams per dl, so it will go down gradually and patient will develop all features of hypoalbuminemia. So you will have to work on liver functions step by step in this way. Apart from this, you will have to work on viral etiology. You will have to study for all advise study of all the viral markers of hepatitis B, of hepatitis C, hepatitis A, hepatitis E. All viral markers are to be done in cases of hepatocellular failure. Apart from this, in investigations in chronic liver disorders, your ultrasound of abdomen is advised. This ultrasound of abdomen will help in estimating the size of liver. It will help in estimating the portal blood flow. It will help in estimating the severity of ascites. It will help in estimating the size of spleen. So ultrasound of abdomen is must in the cases of chronic hepatocellular failure. In chronic hepatocellular failure, always advise for serum ammonia level. If serum ammonia levels are increased, this suggests that patient is going towards hepatic encephalopathy. Serum amino acids levels. If serum amino acid levels are increased, then it suggests that again there is impaired liver functions and the prognosis in such type of cases is usually not so good if serum amino acid levels are increased. So one by one, like this, you will estimate different liver functions, then you will do ultrasound of whole abdomen and ammonia level, and these, with the help of this, you can decide about the prognosis of patient in hepatocellular failure. Usually it is seen that if in chronic liver diseases serum bilirubin is continuously increased, prognosis is not good. If continuously serum ammonia level is increased, it is said that prognosis is not good. If continuously amino acid levels is increased in serum in chronic liver diseases, it is said that prognosis is not good in these patients. So to conclude with this lecture, I will say that whatever I have said about the hepatocellular failure, it should be applied practically in the patients whenever a patient of hepatocellular comes to you, and bring all these things in your mind to decide about prognosis and treatment of patient. Thank you.